Asthma is a condition that cannot be cured, and long-term care will be needed. If you or your child has asthma, it can be quite scary. However, asthma can be controlled. If you or your child has asthma, then you should have a written asthma action plan. A written asthma action plan is a plan that you develop with your doctor to help control your asthma. It shows information such as your daily treatment, as well as the medications to be taken and when to take them. The plan also describes how you can control your asthma on a long-term basis and what to do when you have an asthma attack. The asthma action plan consists of 3 zones. The green zone is for when you are well and there are no asthma symptoms. If you are in the green zone, then you just have to continue with your regular controller or preventer medication. The yellow zone is also known as the caution zone. This may be when you are having an asthma attack, when your peak flow reading is 50 to 80% of your personal best, or when the air is polluted. If you are in this zone, it means you will need an increase in medication. Simply follow the treatment or management plan that your doctor has set. You are in the red or danger zone if your peak flow is 50% of your personal best. This signals a medical alert. Follow the treatment plan that your doctor has set and seek medical attention immediately. If your child has asthma, everybody who takes care of the child must know about this asthma action plan and must be able to help your child follow the plan. If followed properly, the written asthma action plan can be very effective in preventing your asthma from getting worse. The asthma control test is another way to check if your asthma symptoms are well controlled. If your child is between 4 and 11 years old, he or she can take the childhood asthma control test. For each question, there are few possible answers. Follow the instructions on the left on how to complete the test. The total score will tell you if your symptoms are well controlled, partially controlled, or not controlled. It is important that you know how to manage your asthma or that of your child. Work with your doctor or nurse to develop the asthma action plan. Keep a recording of your peak flow readings. It is important that you keep a continuous record of your flow rate. This will help you notice patterns that occur when your reading is low or decreasing. Use your controller or preventer medication daily. Recognize what triggers your asthma and avoid them if possible. Asthma symptoms may change, becoming more or less severe over time. Thus, it is important that you keep an open and regular communication with your doctor and nurse. We would like to thank the following for their contribution: